I want you to picture a feeling for a second.
Oh boy.
Yeah. And if you've actually experienced this, I apologize in advance because just thinking about it is probably going to make your jaw tense up.
Fair warning.
You wake up at like 2 in the morning and there is this severe, relentless throbbing on one side of your face, a toothache.
The absolute worst.
Right. Not just a mild sensitivity, when you bite into a popsicle. I mean, the kind of deep, blinding pain that makes sleep just a completely distant memory.
Oh, absolutely.
Eating your favorite food is suddenly impossible. The pain is radiating up into your ear. It's shooting down your neck.
Yeah, it takes over your whole head.
Exactly. So you finally make it into the dentist chair the next morning. You're exhausted. You're holding your swollen cheek. And all you want to do is point to the problem and shout, please, just pull it out.
I mean, it is such a raw human reaction.
Yeah.
When you're sitting there in extreme localized pain, your brain isn't thinking about the next 10 years of your life.
No, of course not.
It is entirely focused on the next 10 minutes. We naturally crave the absolute fastest and usually the seemingly cheapest exit from that agony.
Just get it out.
Exactly. The idea of just extracting the problem tooth feels incredibly logical in that heightened sleep-deprived state.
It really feels like hitting the big red eject button.
Yes.
You just want the source of the pain gone.
Huh.
But that actually brings us to the mission of our deep dive today.
Right.
We are exploring the hidden biological and financial consequences of our dental choices. Specifically, we're diving into the great debate. Getting a root canal versus just pulling a problem tooth.
It's a huge decision.
It is. And our source material today is this fantastic educational guide provided by Westbrook Family Dental.
Yeah, great resource.
They're a modern, family-friendly clinic located in Westbrook, serving the wider Toowoomba area in Queensland. And their guide really pulls back the curtain on what actually happens beneath the gums when you make that split-second choice.
What we are going to see today is that pulling a tooth triggers a massive structural and financial cascade that most people simply never see coming.
Wow.
The relief you feel in that moment when the tooth is gone is very real. But the biological cost of that relief is staggering, and it starts happening almost immediately.
Okay, let's unpack this. Is the immediate relief of an extraction actually an illusion of a quick fix?
Completely.
Because I think for most of us, if the tooth is gone, the problem is gone. You spit out the gauze, you go home, maybe take some ibuprofen, and you get on with your life.
That's the hope, right?
Right. So what is actually happening biologically the moment that tooth leaves your mouth?
What's fascinating here is the sheer biological efficiency of the human body. Our bodies are incredibly resourceful,
Okay.
but sometimes that resourcefulness works entirely against us. We really have to look at the symbiotic relationship between your teeth and your jawbone.
Because they work together.
Exactly. Most people think of the jawbone as a static piece of anatomy, like a rock. But it is living tissue that is constantly remodeling itself based on the physical demands placed on it.
Huh.
When you have a healthy tooth, every single time you chew, talk, or even just swallow, the root of that tooth sends a microscopic shockwave of mechanical force down into the jawbone.
So it's essentially sending a constant physical signal downward.
That mechanical action tells the cells in the bone, they're called osteoblasts, that they have a job to do.
Okay.
It says, hey, we are actively using this area to process food. Keep sending calcium, keep sending blood flow, keep the bone density strong right here.
That makes total sense.
But when you extract a tooth, you aren't just removing the visible white part above the gums, you are removing the entire root structure beneath it.
The whole thing.
Right. Suddenly, that specific area of the jawbone is no longer receiving any mechanical stimulation whatsoever.
It just cuts off the supply line entirely.
Completely. And the human body hates wasting resources.
So what does it do?
When that physical pressure stops, the body essentially determines that it doesn't need to support a tooth in that location anymore. It deploys different cells to start scavenging the calcium and minerals from that part of the jaw to use elsewhere in the body.
Oh, wow.
The bone literally loses its biological purpose and begins to dissolve.
That brings to mind an analogy.
Yeah.
It sounds like what happens to a muscle.
Oh, exactly.
Right. Like if you break your arm and the doctors put in a plaster cast for 6 weeks, you aren't using those muscles at all.
You can't.
And when they finally saw that cast off, your arm is visibly smaller.
Yeah.
The muscle has atrophied because it wasn't getting any resistance or exercise.
Yes.
So the jawbone is doing the exact same thing when it loses the exercise provided by the tooth root.
The mechanism is surprisingly similar. Yes, the jawbone goes into a state of rapid atrophy. But the speed at which this happens is the really shocking part of the Westbrook Family Dental Guide.
How fast are we talking?
According to their data, within the very first year of extracting a single tooth, you can lose up to 25% of the supporting bone structure in that specific area.
Wait, a quarter of the bone volume? Gone.
Gone in just 12 months.
A quarter of the bone mass just dissolving because the root isn't there to give it a workout? That's wild.
It really is.
And I have to assume this isn't just an invisible problem happening on a dental x-ray. There has to be a physical aesthetic consequence to that much bone vanishing from your skull.
Oh, definitely. The jawbone is the foundational architecture of the lower half of your face.
Okay.
When that bone starts to resorb and melt away, the skin, the fat pads, and the muscle on top of it lose their underlying scaffolding.
So everything just sort of drops.
Exactly. Over time, this bone loss literally changes the physical shape of a person's face.
Wow.
It leads to a sunken-in appearance around the mouth and cheeks, the lips can thin out, and the chin can appear more prominent or pointed.
Because the support is gone.
It effectively makes someone look prematurely aged because you are collapsing the tent poles that hold up the facial features.
So we have this hidden biological domino effect happening beneath the gums, where the foundation is actively dissolving.
Yes.
But because that foundation is disappearing, the structural integrity of everything else around it is compromised too.
It's all connected.
Right, which moves the chaos from beneath the gums to the very visible area above the gums, affecting the teeth you still have left.
That's the next stage.
And the source material uses this great bookshelf effect analogy to describe this.
I love that analogy. Think of a row of tightly packed books on a shelf.
Okay.
As long as they are all sitting there together, they hold each other upright through mutual pressure.
Yeah, they prop each other up.
But if you pull one thick hardcover book right out of the middle of the shelf, the dynamic changes instantly.
The books on either side start to lean and tip over into the empty space.
Exactly. The structural principle is identical in your mouth. When there is a gap from an extraction, your neighboring teeth do not stay perfectly straight and rigid.
They don't.
No. Without that adjacent support, they naturally begin to shift, drift, and tilt into the newly emptied space.
Wait a minute. I have to challenge this visual a bit.
Okay, go for it.
I'm imagining a bookshelf, but books aren't rooted into a skeletal foundation.
Yeah.
Teeth are anchored into our jawbones.
Right.
Do they really just slide around that easily the moment a gap opens up? I mean, they are hard, bone-like structures, not paperbacks leaning on a mahogany shelf.
It is a totally natural pushback because when you tap on your teeth, they feel completely immovable.
Yeah, they feel solid.
But the reality of your mouth is that it is an environment of constant, massive dynamic forces. Every time you bite down, your jaw exerts immense pressure.
Like when you're chewing.
Right. We are talking about up to 200 pounds of force on the molar regions.
Wow, 200 pounds.
Yeah. Furthermore, your teeth are not rigidly cemented directly into the bone. They are suspended in their sockets by a highly elastic tissue called the periodontal ligament.
Oh, I see. So they actually have a tiny bit of give to them.
Exactly. They are designed to have micro movements. That ligament acts as a shock absorber.
Okay, that makes sense.
The entire arch of your teeth relies on mutual side-to-side support to resist those massive biting forces, along with the constant pressure of your tongue pushing outward and your cheek muscles pushing inward.
So it's a very delicate balance.
Highly delicate. When you remove one tooth, you break the integrity of the arch. You remove the lateral support.
And the balance is ruined.
Yes. The constant pressure of chewing and speaking immediately starts pushing the neighboring teeth into the path of least resistance, which is that new gap.
It's like a slow-motion architectural collapse.
That's a great way to put it.
And as those neighboring teeth start tipping and drifting, it creates a whole new set of secondary health risks. The guide points out that this physical shifting ruins your bite alignment.
Completely throws it off.
Suddenly, your upper and lower teeth aren't meeting the way they were engineered to interlock. That makes chewing difficult and can cause severe jaw joint pain.
Yes, TMJ issues are very common with this.
But it also creates these weird, angled, hard-to-reach pockets between the leaning teeth.
And that is a huge problem. Those newly formed pockets become the perfect sheltered real estate for plaque and bacteria to thrive.
Because you can't reach them.
Right. When teeth are tilted, your toothbrush bristles and your floss simply cannot clean the surfaces effectively.
Oh.
Plaque builds up rapidly in those hidden areas, which significantly increases your risk for severe gum disease and entirely new cavities.
Which brings us to the ultimate painful irony of this whole situation.
Oh, the irony is thick.
You sit in the chair and beg the dentist to pull the tooth to stop the pain and solve your problem.
Right.
But by pulling that one tooth to escape the immediate agony, you are actually mathematically increasing the risk of gum disease and more tooth decay in the healthy teeth next door.
Yes, you are.
You haven't solved the problem, you've just outsourced it to the rest of your mouth.
You've initiated a chain reaction.
Yeah.
And stopping that chain reaction once the teeth start migrating and the bone starts dissolving is incredibly difficult.
So if the biology is so undeniably in favor of keeping the natural tooth to prevent this collapse, why is anyone actively choosing an extraction?
That is the million-dollar question.
Why do people avoid the better biological choice? I think it usually comes down to one word: fear.
Without a doubt.
We need to take a minute to deconstruct the completely outdated reputation of the root canal.
Please, let's do this. The phrase root canal still makes people shudder, but that fear is largely based on legacy information.
Like old movies and stuff.
Exactly. People are remembering the dentistry of the 1980s or 90s, or they're holding on to horror stories passed down from their parents.
Right.
The field of endodontics has evolved light years beyond those days.
And the Westbrook Family Dental Guide is very explicit about how much the technology has changed the patient experience.
It's incredible.
We're talking about advanced 3D imaging, specifically cone beam CT scans, that map the exact topography of the tooth before the dentist even picks up an instrument.
It changes everything.
Because in the past, dentists were looking at flat 2D x-rays that were essentially just shadows on a wall.
Right, trying to guess the depth.
Yeah. Now, they can virtually walk around inside the root structure on a monitor.
That technological leap eliminates the guesswork. They aren't going in blind.
Which is reassuring.
Very. Combine that precision imaging with the evolution of modern anesthetics, and the clinical reality changes entirely.
How so?
Well, today, anesthetics can be delivered to highly specific nerve blocks. The dentist knows exactly where the nerve pathway is, meaning they can numb the tooth with absolute certainty.
No more feeling it halfway through.
Exactly. Because of this, patients consistently report that getting a modern root canal feels no different and causes no more discomfort than getting a standard routine filling.
That is huge.
Yeah.
Let's demystify the actual mechanics of the procedure, though, because fear often stems from just not understanding what is happening behind the curtain.
Right, the unknown is scary.
During a root canal, the dentist creates a small opening, goes inside the tooth, and removes the infected, inflamed pulp tissue that is actively causing your throbbing pain.
That's step one.
They carefully clean and sterilize the hollowed-out canal, and then they fill it with a biocompatible material and seal it up to prevent future infection.
That's the whole process.
So what does this all mean for the jawbone? I need a little clarification on the biology here.
Okay, shoot.
If the dentist goes in, cleans out all the infected pulp in the nerves, and seals it up, the tooth is essentially dead on the inside.
Yes.
There is no living tissue inside the canal. How does a hollowed-out, sealed tooth still manage to trick the jawbone into staying strong and healthy?
That is a great question. The answer lies in the suspension system we talked about earlier.
The ligament thing.
Yes, the periodontal ligament. And this concept called mechanotransduction.
Mechanotransduction.
Got it. The jawbone doesn't actually care whether the internal nerve of the tooth is alive, dead, or removed.
Wait, really? It doesn't know?
It doesn't know and it doesn't care. The bone only responds to physical pressure. Because the rigid physical root of your natural tooth is still firmly seated in the socket, and the ligament on the outside of the root is still intact. Every time you chew, that root is still pressing down into the hammock.
So the shock absorber is still firing, even though the inside of the tooth is hollow.
Exactly. The mechanical pressure of the natural root pressing against that ligament sends the exact same signal to the osteoblast cells.
Keep the bone strong here.
Yes. It provides all the vital stimulation the bone needs to regenerate and stay dense, completely regardless of what is happening inside the tooth's canal.
That is brilliant design.
It really is. By keeping the root, you are preserving the architectural load-bearing tiller of your jaw. Nothing made in a dental laboratory will ever compare to the structural perfection of your natural tooth root.
Okay, so we've settled the biological debate. Nature's root, even if it has been hollowed out and sealed, is vastly superior to an extraction.
Without question.
But we have to pivot to the final factor. For you listening right now, the deciding factor might not be biology. It might be money.
Yeah, that is usually the tiebreaker.
We need a financial reality check, because the upfront price tag on the day of the severe toothache is usually what pushes someone toward asking for the extraction.
It is the elephant in the room. We have to acknowledge the absolute truth of the situation.
Right.
If you look strictly at the upfront day of invoice, pulling a tooth is going to be significantly cheaper than performing a complex multi-step root canal therapy.
Here's where it gets really interesting. Choosing an extraction to save a few bucks today is exactly like taking out a payday loan on your mouth.
Ooh, I like that comparison.
Think about it. Sure, you get a little extra cash in your pocket right now because the extraction was the cheaper option on the menu. But the compounding interest on that biological loan comes in the form of dissolving bone, shifting teeth, and ruined bite alignment.
And eventually, that loan comes due.
Yep.
You cannot just leave a gap in your mouth forever without facing those severe consequences. To fix the drifting bite and stop the facial collapse, you will eventually need to replace that extracted tooth with a prosthetic.
And what does that actually look like? We throw the word implant around, but that is a major procedure.
Oh, it's massive.
Yeah.
A dental implant isn't just a fake tooth they glue into the gap. It is a multi-stage surgical process.
Surgical. Wow.
Yes. An oral surgeon has to fold back the gum tissue, drill a hole into whatever bone you have left.
Then remember, you've been losing bone since the day of the extraction.
Exactly. They drill into that remaining bone and drive a titanium screw directly into your jaw.
Ouch.
Then they stitch it up, and you have to wait 3 to 6 months for the bone to heal and fuse to the titanium before they can even attach the customized porcelain crown on top.
3 to 6 months with a screw in your jaw. Or, if you don't get an implant, you have to get a dental bridge.
Which is also intense.
Right, because that requires the dentist to literally grind down and file away the healthy enamel on the neighboring teeth just to create anchors for the bridge.
It's just more damage. If we connect this to the bigger picture, the final financial calculation is completely undeniable.
Let's hear the math.
When you take the relatively low cost of the initial extraction and you add it to the thousands of dollars required for a future surgical titanium implant or bridge.
It's like the extra visits.
Yes, plus the multiple extra visits, the specialized surgical scans, and the sheer amount of time you will have to spend sitting in a dental chair recovering from those procedures.
Right.
It is significantly more expensive than simply saving the tooth with a root canal today.
Investing in a root canal isn't just about avoiding a gap in your smile. It is genuinely the most cost-effective preventative health investment you can make for your structural anatomy.
Spot on.
You are paying once to keep your original parts, rather than paying continuously to manage the biological collapse of losing them.
It's playing the long game.
Exactly. Let's bring this all together. The core philosophy we've extracted today from the Westbrook family dental material is beautifully simple. Preserve your natural smile for as long as humanly possible.
Absolutely.
If you are sitting there with a toothache, do not wait until the pain becomes so unbearable that you make a panicked split-second decision in the chair to just rip it out.
Take a breath.
Right. And for those of you who might be listening to this with a throbbing jaw right now, we want to make sure you have the specific practical details from our source.
Very important.
Westbrook Family Dental specifically offers flexible payment options to help manage that upfront cost.
That's great.
And they offer sedation choices for nervous patients. That means fear of the procedure and fear of the immediate bill shouldn't be the things that cost you your natural tooth.
They've removed the barriers.
They really have. If you are in Toowoomba, Westbrook, or the surrounding areas, you can call their team directly at 07-4529-7477.
Okay.
Or you can visit them online at westbrookdental.com.au to book an appointment and explore your options.
This raises an important question, though.
Yeah.
We've spent all this time looking incredibly closely at the mechanics of the mouth. But think about the wider implications.
Okay, I'm listening.
If losing just one tiny, unseen tooth root can literally trigger a domino effect that alters our bone density, shifts our skeletal alignment, and fundamentally changes the physical shape of our faces.
Which is terrifying, by the way.
It is. But it
Yeah.
makes you wonder, what other tiny, seemingly isolated parts of our anatomy are we taking for granted right now that are secretly acting as the vital, load-bearing pillars of our overall health and appearance?